So sometimes we tend to run after a brand new and untried technology instead of looking carefully and comparing it to what the front level of the old technology is. And this is, again, an important background way to think about outcomes that might save you considerable distress. Neither the surgeon who is performing the well-known procedure nor the surgeon who is developing the new procedure will give any credence to the business end of it. And this is something that's very important for you to understand. And this is a primary philosophical piece. People who are in business have owners, they have stockholders, they have stock. And the rule in business is caveat emptor. You know, the old Latin term means buyer beware. That is a normal, real, perfectly logical and sensible business position to be in. But people who do what I do for a living live by a completely different standard. Ours is first do no harm. So we have to live by a different standard. We cannot be influenced by what's in the newspaper about some newfangled technology that somebody's trying to get on the market so that they can get a big liquidity piece, get bought up by a big company and become wealthy. That's a perfectly normal, human, and good thing, because all good new technology comes to the market that way. But as we are judging new technology versus the older technology, people like me can't afford to be influenced by buyer beware. We have to first not harm you. We have to do what we know works. And so it's easy when you're looking up outcomes to basically be taken in by advertising. And there's a ton of it out there, subtle and not subtle. I mean, try listening to the evening news sometime without being hit up to listen about some medication that can give you some benefit. Basically, they're advertising something in the business sense that in a way they shouldn't be doing, because the set of ethical principles that guide businesses are not the same ethical principles that drive medicine. First, do no harm, huh? Now, one of the critical things to understand is that any new technology, or many new technologies, actually breach the standard of care, the current standard of care. So the new treatment changes things that were present in the old treatment, and we hope for the better, but it's not always for the better. And so the question that people like me ask is, does the change that the new technology causes pay the patient back for the risk they're taking? For instance, in my case, I do lots of cases that involve the heart-lung machine. Suppose we had a procedure that took twice as long on the heart-lung machine, but the incision was only half as big. Which is better for the patient? To have an incision that instead of being this long is this long, but twice as much time on the heart-lung machine, or the other way around? Should we have half the time on the heart-lung machine and a somewhat bigger incision? Well, the bigger incision causes cosmetic disadvantages, but the heart-lung machine, while it's a life-saving device, is not something you want to spend all day on. So these are the kind of trade-offs that we worry about when we introduce new technology. Can the new technology compensate the customer, the patient, for any changes in the current technology? Because we could be taking one step forward and two steps back. Do you see? If we take twice as long on the bypass machine, we introduce another whole set of difficulties for the patient. Is that worth having a smaller incision? Well, maybe if you're Miss America, but it might not be if you're just an ordinary person that doesn't want to be hurt. This is a very important thing to think about. And sometimes in the new technology, of course, things don't work out. Now, this doesn't mean that I'm negative about new technology. I'm not. But I'm very disturbed when patients call me up and ask, can I do a certain operation through a certain incision? And I'm happy to answer that question, but I'd like them first to ask, Doctor, how many of these have you done? Doctor, how many times out of 100 that you do this is the patient completely relieved of his symptoms? Doctor, when you do this operation, amongst the survivors of this operation, how long are they disabled? How much suffering do they have post-op? How soon can they return to work? And then finally, what will my incision look like? Can you do it through a robot? Can you do it through a small incision? So that ordering of questions means that you've thought through the problem of outcomes correctly. and you're actually then ready to have a conversation with somebody like me about your precise situation. So I hope this little discussion has had some service for you. And at the end of this, we'll put up a website on the screen for you to get some more information if you want to learn about specific outcomes. Thank you very much.